Today I'm going to be a little spicy. Gotcha. That's it. There's the rest. Gotcha. Welcome to the office. So, diagnosed with rheumatoid arthritis, hand pain.
Yeah.
You were having hand pain.
Yeah.
But right now you have localized neck pain here.
Yes.
And it causes your arm to go weak and lose power.
Yeah.
Correct?
On the right.
On the right side.
Yes.
The left side is okay?
The left is okay.
Okay.
And
what?
then, okay. And then I have a lower back pain too.
Okay.
That one is coming whenever, even when I put my belt a little bit tight, I feel it right away, and then I try to lose it. And
Local pain or shooting pain? Is just in your back or it goes down your leg?
No, on my back.
Okay.
Somewhere around my back.
Okay.
And then I had a muscle pulled one time, a serious one. And always when it's stuck in that way.
On the right?
Yeah.
Okay.
And then one more thing, whenever I stand, I feel like I'm comfortable on one side.
You tilt to one side?
Yeah.
Yeah.
And then I was like, even when I wash my hand, I do like that.
To the right?
Yeah.
To the left, sorry.
I mean, yeah, to the left.
Okay.
The other thing, I cannot grab in something quickly. Like when I go down, I was like...
Because of pain and
yeah, my back.
And
back
stiffness,
pain.
right?
Back pain, yes.
Stiff and pain.
Yes.
Okay. All right. That's a good start?
Yeah.
What else?
When I sleep, I prefer to sleep on my right side. It's not comfortable to sleep on left side.
Correct.
On my left side.
I'm going to explain all this, okay?
Okay.
I'm going to explain your x-rays. I'm going to explain what I find.
Okay.
We'll then do your examination, figure out where we're going to start today.
Okay.
You're coming from Davis, right?
Yes.
Northern California.
Yes.
So you're here for an initial visit consultation and figure out what's going on.
Okay.
Okay? As I do with all new patients, I ask for 4 visits to figure out the case. Okay? So people come in, we'll give you your answer today, and we'll get started.
Okay.
All right? You ready?
Yeah.
You're complaining up here like the 15th floor of your building, 16th floor. You're also complaining over here in the low back. We're going to look and see first, do we have a level base and foundation, and what has happened as a consequence of that, okay? This is your side profile. On your side profile, we're looking at a few things. Number 1, we're looking at posture. So we run a posture line straight up from the low back, and we run it straight up. This line should pass through the base of the neck here. What it's showing us is you carry your upper body behind your foundation. And as a result of this, these muscles and ligaments have to work overtime just to hold him upright. So part of the answer is the posture. It's not the whole answer, but part of it is the posture. That's number 1. Number 2, do we have the right spinal curves? We should have a forward curve in the neck, back curve in the mid-back, forward curve in the mid-back. What I see here is I see a little less curve here in the low back. And then something happened either at 3 or 2 that caused the whole spine to go back, shift back. And as a result, these muscles and ligaments are working overtime to hold it upright. The next part of it is the neck. If we look at the neck, overall neck discs are decent. This one is a little bit less. But what you can see is we have a loss of curve. It's not going forward as it should. It's going straight and starting a slight reversal here. And then I don't see the space here between the occiput and the atlas here. There should be a space there. So there's definitely something going up in the penthouse, up in the top of the neck here, number 1. Number 2 is the basement. So let's explain the foundation and let's show you what's going on here. So I said we need to have a level base and foundation. And what's the first thing we see? Are we level? No, we are not. We have a slightly lower leg on the right. We have a rotated sacrum on the left. The sacrum is dropped on the right. I'm going to explain all this in detail. I'm just doing the overview. And we have misalignment of the pelvis. So let me explain. I'm going to explain the left side. You've had some injuries here for sure growing up. These imbalances have accumulated over time. And the reason I'm saying that is this. Let's look at the foundation. I'm going to reference your left side because the sacrum is rotated on the same side of the misalignment. Okay? This is your SI joint on the left. The left side turns, well, let's look at it this way. Your left pelvis goes in, your right pelvis goes out. Your sacrum on the left side goes back. So this is going back, this is going back. And then the sacrum goes down a little bit on the right, and then the whole thing goes down. So there's the imbalance, sir, in the foundation. And we need to figure out which started the process. I can already see an old tailbone injury at S5 right there. It's tilting a little bit down. The actual difference versus the measured difference. Now there's some good news here. There's a lot of good news, by the way. Right now, your right hip is down 5 millimeters. As long as it's under 7 millimeters, the adjustments will hold, okay? But 5 millimeters is down. If we correct the pelvis, we should be able to get it to 3. That's what the AD is, the actual difference. So regardless of whether it goes up or down, it's still within normal limits. But because your right side is down, you're leaning to the left. You're trying to balance, otherwise you feel like you're going to fall over on the right. So you have to tilt to the left side. Make sense? Okay. So that's the start. We have to figure out the foundation first. Are we working on the sacrum first? Or are we working on the pelvis? There's two things going on. Your overall effect is you go to the left when you walk. So I'm assuming she's on the right. Okay, when you guys walk, you're on his right. If you're on his left, you guys bump each other, I'm pretty sure. Okay, so that's number one. Does that make sense?
Yes.
Okay. Now, let's go to the side profile of the low back and show you this. When we're looking at these disc spaces, okay, we can infer in this work kind of time frames of injury. If I look at, this is a perfect disc. These are level. This is a great disc. This is a little tilted, but still good. This was an old injury as well. This is the first floor, or L5. The shape of this disc tells me that's at least a 20 to 25-year-old injury, not 3 years ago. Okay? That's what that's telling me. And you can see there's a little, it's very small here versus the front. So there's probably that misalignment. This is a normal vertebrae. Vertebrae, disc vertebrae, this is the nerve that exits. So what yours did is it tilted back from misalignment, and as it tilted back, it started to wear out in the back there. So if we look here, you can see this one, it's closing off in the back. But it's not the bone that's pinching the nerve. It's the inflammation from the disc that's causing that. So when you're in certain positions, it pinches that nerve, you feel that pain. Does that make sense?
Yeah.
Okay. So we have the basement that we have to deal with first before we get to the first floor. Okay? Now, as we go up the spine, these discs are good. That's your good news. These discs are all good. These discs are all good. There's a little bit of pinching here in between the shoulder blades. I'll go on the other x-ray to see more detail. C2, C3, C4, C5, C6. C6, probably C7 is where this is starting from in the neck. So in order to get this curve back, this is probably where we're going to need to start, probably, for the fix. And I want to talk about something because you said you were diagnosed with rheumatoid arthritis based on the x-ray and symptomatology, but the blood work didn't support it, right? And typically we're looking at inflammatory markers. Now, the way I've seen rheumatoid arthritis, and Dr. Gonstead, the founder of this method, he was born and suffered from juvenile rheumatoid arthritis, so he was born with it. And he was bedridden at the age of 16, and no one was able to help him. And there was a chiropractor he found in another town, and Dr. Olson, and Dr. Olson started working on him, and Dr. Olson changed his life, and that's why he became a chiropractor. Okay, so one of the things we're looking at in rheumatoid arthritis, number one, is nerve pressure, but more importantly, now we're going to go back even further, back in the 1800s. They used to treat rheumatoid arthritis as a digestion problem, okay? And I can see there is some digestion issues going on, and I'll explain that in a second. So the idea back then was leaky gut in the stomach, translocated microorganisms leave the stomach, they go to different parts of the body doesn't recognize it as itself, and it produces antibodies and starts that erosion process. Okay? So the way we manage or help it is through the nervous system, but also digestion. Now, the fact that you had your gallbladder removed, I talk a lot about this in older videos. This is never a cause. Okay, you had gallstones, I'm assuming, right? You had stones in there? Okay. And I talk a lot of detail as to where that comes from. I'll send you a link for that video I want you to watch, okay? And basically, if we had a gallbladder removed, we probably had hypochlorhydria, low stomach acid, where we didn't stimulate the gallbladder to release the bile. We had backup of the bile, and we produced these stones. Okay. Now, the fact that it's not there, did they tell you how to eat? Because your eating habits have to be completely different.
A small amount.
Smaller meals, right? Less fatty meals, right? And 5 or 6 meals a day, not 3 meals a day. So you want to eat smaller portions so the body can digest it properly. What is the gallbladder? The gallbladder is a storage organ for the bile, but the bile is produced in the liver. So you're still making bile, but you have to use it. If you eat too much, there's not enough bile to break down those fats. And I know you eat all that yummy food. I know you do. I know you. I like the bread. I like the Ethiopian bread. It's really yummy. So does that make sense?
Yes.
So now let's put a few things together. We have a foundation issue. We have L5 issue. We have digestion. Now digestion can be coming, as I see, from the middle of the back here. It can be coming from the upper cervical, which I'll explain in a minute. When we're looking at his spine, it goes up. You can see this is all undigested food. The good news is he has a decent sized meganblasia. I talk about the gastric air bubble. It can be a little bit bigger, should be about that big, but still you have a good sized meganblasia in terms of the space in the stomach for digestion.
What is that? I mean, what is the purpose, the function?
It should be there. There should be the air bubble there. It tells us that when the food enters, it's able to mix properly. As that starts to shrink, what I have seen, there's low stomach acid. Okay? Now, you still have a good size there. Okay? But the fact that I see all of this is undigested food in the gut, and I see that you had your gallbladder removed, I'm pretty sure there's a stomach issue, and then it also relates back to the rheumatoid. So it's all kind of connected.
Okay.
All of it is connected. Now, let's go up. You have work to do, dude. This ain't happening in 1 or 2 days. I'm letting you know right now. T1, T2, T3, T4. He has a T4 side slip. There was some injury that happened here from right to left side. And this is what throws your whole neck off, okay? If you see here, look. It comes like this, it goes here. Then from here, it goes to the right side the whole way. Do you see that? It tilts like that. So his neck issue is actually starting at T4. But T4 is coming from also foundation. Yes, sir. Okay, now let's get to the top. Now, when we look at the top, we got a couple issues going on here too. We have upper cervical. We have C2 is tilted on the right and twisted to the left. And C1 is up on the right. So we have the critical atlas as well. Now, let's put it together. We have critical atlas, we have T4. There's probably something going on in here, but a lot of this is all compensation to
I
that.
have a pain here.
That's the middle here. So all of this is due to what? Imbalance.
Can you
Yeah.
explain how you connected the undigested food with rheumatoid?
Absolutely, and you can look in the history, okay? Back the way I was trained in it, the way we studied it, back in the 1800s, they found these inflammatory arthritis, they call it inflammatory arthropathies, such as rheumatoid or psoriasis or Sjogren's, things like that. And what they found was leaky gut, translocated microorganisms that are normally in the gut. They leave the stomach from bad digestion and bad colon, and they start going to the body. And certain parts of the body doesn't recognize it, so it produces antibodies. It's an autoimmune response. So rheumatoid is an autoimmune response. Now, everyone has their theories. That's the way I looked at it. That's the way I trained in it. So whenever I'm helping someone with rheumatoid, nerve pressure, but you got to fix the digestion or nothing gets fixed. There's always inflammation. Does that make sense? So we got a little bit of work to do, okay? Today's going to be a little spicy.
Oh, really?
Oh, yeah.
Um,
It is what it is.
I pray.
How many kids you have?
2.
Okay. So spicy shouldn't be too bad. I'm joking a little bit, okay? Let's figure out what's going on.
Okay.
Okay? Go ahead and walk, please. Keep walking. You've watched a few of my videos?
No.
You never watched my videos?
No one said.
How did you find me?
My cousin, he came like 3 years ago. And then
From San Diego?
San Diego.
Ah,
They had
okay.
the same
Which
issue
one?
at the same
Hold on,
time.
I have a few of them.
Dad.
His wife and his son is
Got
getting
it.
a treatment here.
But Alex never told you to watch a video? He just told you to come see me?
Yeah.
So you have no idea what
Because,
you're getting into?
At the right
He had
time.
the same issue at the same time.
Same time.
But he doesn't. But you didn't watch any videos.
I didn't.
So you have no idea what I'm about to do.
No.
Alhamdulillah, look. Maybe it's a good thing. So when he walks, you can see he got the Ethiopian wiggle. He walks like this. I'm making fun of it. Okay. You don't take offense, right? I make fun a little bit. So when you're walking, the SI joint should move like this, his dimples. He walks like this. Keep going, one more time. That left side kicks out. This is a left SI joint issue. This is a left SI joint, left pelvis, and L5. So I know you're feeling the right side, but it started on your left. Walk one more time, please. Alex sent you, huh? Well, you're gonna love your cousin or hate your cousin today. Have a seat over here. Oh, let's run the meter on the back. Let's see what we find. Ah, Bismillah. Starting at the base of the neck. Head down, sir. Good. How is he doing?
They're good.
They're doing good?
All fixed.
Good. You know, it happens. I see patients over so many years. I've been doing this 20 years. See 7, 10 points. And then I don't hear from them for a long time. And then I thought they just disappear. And then I see some patients after several years. I'm like, oh, what happened to you? Then you fixed me. It's done. And that's the idea.
I think that's what happened with them.
See 7, 10 points, right side. Ten points, see 1 occiput, left side. T4, 10 points, left side. Now the fun. L5, 10 points, left side. S5, S5, L5, T4, C7, and upper cervical. Those are the spots that I'm getting. It doesn't mean I'm adjusting all of them. It means it's going to be in one or two of those or more. Static palpation, running my fingers down the spine. 7, 1, 2, 3, tender. Pain here when I push or here?
One more time.
This
Right
one?
there. Yeah.
That's T4. 4, 5, 6, 7, 8, 9, 10. 4, 3, 2, 1, 7. Look up, please. All the way up and down. All the way up and down. So we're checking P-Day glide. 7, 6, 5. The first part of the misalignment is going to be posterior. So we check for extension. Are those spinuses moving? Are they opening up when you go into flexion? Next is upper cervical. Tender there, yeah?
Yeah.
Right side not as bad, left side more.
Yeah.
We're going to do what's called DeVore's test. It's a test to determine if we're going to work on the top one or the bottom part of the cervical, okay? Ma'am, can you do me a favor? Can you are you cold?
I'm fine.
You're good?
Uh-huh.
Can you uncross your arms, please?
Oh.
Thank you. I talked a lot about it in the
It's
video.
hard.
Energy, energy. Look down, isolating the upper cervical. Turn left, turn right. Look up, isolating the lower cervical. Left, right. Does it bother you more when I do this or when I go down and do this?
Can you do it one more time?
Down and left, up and left.
Now what?
Yes, so we're going to do C7, T4. Now let's check the low back and see. Sit up straight. Now this is how you should be sitting. And I'm going to hopefully get him to that point where it's going to hurt to slouch. Come back slowly towards me, all the way back in extension. This is number 5. 5 is tender.
Yeah.
1, tender. 2, tender. 3, tender. 4. This is where we're going to start. At 5. Do you feel that, sir?
Yes.
Yes. S5, T4, C7. Those are the 3 spots we're going to start on. Okay. You ready?
Yes.
Let's do it. We're going to go on the... So here's the game plan. We're going to do your tailbone. S5, the basement. This table. Then we're going to do T4 between the shoulder blades. Then I'm going to have you walk. Then I'm going to recheck your neck. Okay?
Okay. You're gonna do 2 of those first.
Yeah.
You got this. You can do it.
Yeah.
You got to see his face. Come on. Now, on his case, we're going to do the S5 torque up counterclockwise, and then we're going to do T4 as a side slip. And the listing at T4, 1, 2, 3, 4, PLS side slip. So we're going to have to do it from the right first. Okay, let's do this. Yalla habibi. Slide up, up. There you go. And I just want you to breathe now, brother. Just breathe. Let it go. Relax. Relax. Receive. Good. Deep breathing. Was he being nice to you today? S5. Now, there you go. Perfect. There you go. Nice and easy. There it is. Relax the shoulders, brother. Gotcha. That's it. I got you. That's the home run. T4. T4 we're going to do in 2 parts. I'm going to do the side slip first. 1, 2, 3, 4. So we're going to be on the right transverse. Bringing it down. Drop. And now we're going to take it home. Shukran. Drop the shoulders. Down, down. There's the rest. Gotcha. Alright. Ready? Khalas. Wait for it. Hold my hand, sir. Hold my hand. Come up slowly. When you're ready, march in place. Now let's walk. Talk to your cousin, dude. Let me open the back, please. Walk, please. This is after adjustment. Now we still have more to do. Keep going. Keep walking. Keep walking. Keep walking, sir. Keep walking. As you're walking, tell me if anything is different. Does it feel a little bit different?
I feel like something is like stretched straight like this.
A little straighter, right?
Yeah. I feel like walking like this.
Walking a little
Yeah.
taller. Good. Keep walking. Now, next thing I want you to do, go right side down, put your head over here, and face this way, please. I got you the whole way, sir. Let me do the work. Don't fight me, okay? No fighting. Ethiopia and Tanzania, we have peace, okay? There's peace in Tanzania and Ethiopia, okay? Let it roll, let it roll, let it roll. I won't drop you, my knee is here. Roll, roll, roll. That's the home run, baby. Gotcha. Come up slowly, walk it off, check it out. Walk, please. Whew! Now we got some action in his dimples. There you go. Now we got a little smile. So by the way, the worst part is over.
Is it?
Yeah.
Can we get up usually this fast? Like,
Right?
Getting up.
We're gonna just test something out and you're gonna tell me the difference, okay? I'd like you to sit on the floor against the wall, please, sir. Sit down on the floor.
With my knee.
Just however, just sit on the floor. Take your time, no rush.
My back is too under this?
Yes, yes, back to the wall. There you go. The test is to get up fast. Should be easier now. Come on,
Which side?
just stand up, come back here. Madam, have a seat. What's different?
He got up quick.
Good.
Yeah, it doesn't usually get
I
up
have
that
to
fast.
hold the ground and then
Crawl like.
there is a process to stand.
Now the neck, okay? But before I touch your neck, I want you to move your neck. It should feel different already. Look to the left. Look to the other side. A little different?
It is.
Yeah. I haven't touched the neck yet. Look up, remember, and turn. There.
Earlier there is a pain, yeah, but now a little bit,
Less, right?
yeah.
Good. Sit back for me, please. C7 as a PLS. Left ear. Left ear down. Feet in. Look up.
Ah!
Home run. Gotcha. Sit up straight for me, sir. Now let's rescope and see what happened, okay? Now look how he's sitting. Now he's sitting straighter. Look. It's really cool. That's why Alex sent you, okay? Good job, Alex.
You know how they got your number?
How?
From Ethiopia.
Somebody found me in Ethiopia.
Somebody from Ethiopia told Alex's wife
In San
in
Diego.
San Diego, saying that there's a Dr. Rahim in LA.
You know, it's crazy. That's how it works. I have so many patients who live locally, but their family sees me in another country. I had one guy, his cousin from Italy, and he lives just down the street here. And the cousin in Italy found me and says, go see this guy. That's how the social media works, right? The power of the internet. T4 is clear. C7 is clear. Yalla. Sacrum is clear. Sit up straight. I want you to feel this now. Come back slowly. Back, back. That's 5. I didn't touch it.
No. I mean, it's not like before. I don't have any pain right now.
All good. That's where we're going to start, okay, sir? Now, I'm going to work on your right shoulder. Let me do the work. Drop it down, down. There you go. Look to the left. Look to the right. Look up and left. Good. Now, buff and polish. I'm going to do what's called vibration therapy to break up some scar tissue. There's the buff and polish.
So what the adjustment you did, do they stay where you just adjusted them?
Absolutely not. It's going to slowly revert back because it's been there for so long. Those ligaments have adapted over the years. It's a 20-year-old injury. So the idea is each adjustment stays better each time, and we have to change the habits. If we don't change the habits, nothing gets fixed. I'm going to go over all that with you. Walk, please. Last time. Now tell us what's different overall.
Yeah, I feel like I'm walking straight, and then before I didn't figure it out, but now I know what the difference is. Yeah, when I walk in the first time, my leg is not like easily stretched like free.
You're balanced now, right? You feel more balanced. Good. Let's check the hands, sir. Squeeze my hand. Slowly, slowly. Squeeze. Okay. Lunate. Relax the hand. Relax the hand. Let it go. Let it go. Relax. Relax the hand, dude.
One is the arthritis damage.
Squeeze. Okay. That's where we're going to start, okay?
Okay.
All right, I'm going to give you some homework,
Okay.
and then you figure out which if you're staying or not, okay?
Okay.
Welcome to the office.
All right. Thank you very much.
God bless.
All right.
Okay.